Hi, this is Pete Fernbaugh. Welcome to Trinity Talk. My guest today is Dr. Kenneth Aguirre. He's our pain management and sports medicine specialist down in the St. Clairsville offices of Trinity Health System. Dr. Aguirre, welcome to Trinity Talk.
Thank you for having me.
Absolutely. First thing I want to address with you is your background. You have a very fascinating background. So give us an overview of your training, and then we can get into some of those teams that you've worked for, the sports programs that you've worked for.
Yeah, so I'm originally family medicine trained. I did a fellowship in sports medicine, and I practiced that for about 4 years until I decided that I wanted to help patients a little bit more, and I just completed a pain medicine fellowship. So right now I have 3 specialties: family medicine, sports medicine, and pain medicine. But I practice mostly pain medicine and sports medicine right now.
So you mentioned that you wanted to be able to help people more. Obviously, family medicine is a broad area. What were you seeing that compelled you to go a little farther?
Yeah, so in sports medicine, you deal a lot with acute and chronic pain. When I had a lot of chronic pain patients, I will work them up and find out the underlying cause, and I felt like that was it and I couldn't help them.
Yeah.
So I felt like I needed more training to be able to help them. Sometimes it's a little difficult to see a pain medicine doctor, so I feel like if I can get the skills, then I could help them completely in one place.
And did your love of sports medicine grow from there as well?
Oh, I love sports medicine so much. I want to say I left it. I just built and added to that. I love treating athletes. I love treating weekend warriors. I love the whole aspect of that. Sometimes it could be a little bit of time consuming as you cover teams and travel with them.
Right.
It could take a little bit away from your family. So I think the pain medicine aspect allowed me to still be home with my family and still be in sports medicine.
Yeah, that's interesting, because when you are the team specialist, the team physician, you have to travel with them, of course.
Yeah.
So you're keeping the same schedule that they're keeping every season.
Yeah.
But it sounds like you had some good times when you were doing that.
Really great times. I started off, I did fellowship in Buffalo, so I was team physician for University of Buffalo. We did some coverage with the Buffalo Sabres, the hockey team. That was a really great experience there. And then I went on to be the head team doctor for Grambling State University. So I was their head team doc, and I traveled all over with the team, which was a really great experience. But it's a young kids game because it takes away from the family. Yeah.
Yeah. And you also LSU Shreveport, you worked there?
I worked at LSU Shreveport. I was assistant professor there.
Okay.
In the Department of Family Medicine. I also was associate program director for the sports medicine fellowship.
And you're fluent in Spanish?
I am fluent in Spanish.
So you are accustomed to reaching out to diverse audiences?
Yes. I love treating all type of
or diverse patient
diverse patient. Yeah, I grew up, my family immigrated from Ecuador, and we were a little socioeconomic background, and we grew up in a different area that needed healthcare. So I prefer to, treat those types of communities. I think I relate with them and I can help them as best as I can.
You mentioned the socioeconomic issues that you not only came from, but you are familiar with in interacting with patients. As you know, the Ohio Valley, it may not be the most diverse place when it comes to patient communities, but when it comes to socioeconomic, it's probably very familiar to you.
It is, a patient's still a patient no matter what. So I'm going to go to bat for them. I'm going to do whatever I can for them. I think that's the important part of it. It doesn't matter where you come from, what background, how much money you have. I'm still going to do my best for you.
Right. Do you see similarities between the community you used to work
100%.
with? Yeah.
100%.
What are some of those similarities?
A lot of people are really hardworking on the social coal miners, a lot of farmers. So, and they don't have the resources that maybe you have in a bigger city, and I think that's okay. That's the way they're brought up, and my job here is just to help them.
Excellent.
Yeah.
What did you learn? So it's interesting, you have that background, which makes you relatable here, but we're also heavy, as you've learned. I mean, you live in Pittsburgh, so we're heavy into athletics. It's Friday night lights every night.
Yeah.
And so what did you learn working so closely with teams? What did you learn about athletes, about not just treating them, but about them and how they're wired?
I think athletes are resilient. I think their whole goal is to work at the top of their level. Yeah. And my job is to help them achieve that. And also my job is also to protect them as well. Sometimes they want to go 100% and And I have to be able to give them the knowledge to kind of bring it down a little bit so they could heal and go on to the next step.
Yeah.
But my job as a team physician is to protect them.
So one of the reasons we wanted to have you on is all that information you have, all that data that you have to share with us. We're recording this in October of 25. And of course, we are in the prime time for athletics. So you're probably very busy. What are you seeing this year that may be consistent with other years, but may also be a higher volume of these types of patients?
So usually around this time frame, football season's on, right?
Right.
Especially for high school and colleges and stuff like that. So you'll get the comment like I just had a young gentleman who came in with a knee injury. Also, you get the weekend warriors. I had another gentleman who came in with a knee injury from playing basketball. So it just depends. Most of the time, it's just sports related injuries. But in addition to that, the weather is changing and you get the people with arthritis who have the flare up around that time.
I want to make sure I understand one phrase you've used, weekend warriors. As I understand that term, it's those folks who don't really do anything during the week, and then the weekend they hit it hard.
That's right.
And they wipe out. And,
that's right.
Yeah.
That's right.
Okay, good. I just wanted to make sure. I always have a little concern sometimes that I'm not defining things for our audience. So yeah, those weekend warriors. Yeah.
Yeah.
I think we've all been there.
Yeah. I mean, I want everybody to be active. That's the important thing. So my job is to help you be active. That's how you lose calories. That's how your muscles stay strong. If you sit on the couch, your muscle waste, it's a data of 5 to 10%. You lose if just staying sedentary, and you don't want that. It's hard to gain it back.
Yeah, right, exactly. Yeah, it is. I think I read somewhere once that if you aren't if you're consistently strength training and then you take 2 weeks off, your muscles have already started to atrophy.
Yeah, if you look at somebody, let's say you put a cast on the arm, right? And then they're on there for 4 to 6 weeks and you take it off, you see the comparison between the arm, right?
Yeah.
That's just atrophy. Yeah.
Yeah, it's amazing how fast it
so it's hard to gain it and it's really easy to lose it.
The curse of being human, right? Yeah. So when you are, whether it's an arthritis patient or whether it's a high schooler or a college student who has gotten a knee injury playing a sport, when you're talking about safe and effective pain management, define that for us and then tell us some of what you tell your patients.
Yeah, it's a tough time right now in the pain medicine world just because of what's been going on, right? So it's a lot of issues with opioid management and stuff like that. I think there's still a great role in opioid, but I think trying to kind of control that to a sense and give a realistic approach to the patient. So if a patient comes to me and I'm here from a medication, I try to educate them on what the side effects of opioids and how they could have detrimental effects to their actual health.
Yeah, I'm going to pause you there because what struck me is I would think that would be common knowledge, the side effects, but it sounds like you're dealing with patients who aren't aware that this highly addictive prescription drug. That's right. That's right. Their common thinking is I've been on this pain medication for 10 to 20 years. What makes you different now? And I tell I try to educate. It's look, what happened 10 to 20 years ago, it's not the same medicine now. We have more data. Yeah. We have more evidence to kind of back up on why we should kind of decrease this and maybe try an interventional option to kind of help you with your pain. And when you introduce an interventional option, what are some of those options that you suggest? So we have different options just depending on what kind of pain you have. We have ultrasound guided injection, fluoroscopy guided injections to a specific joint, ligament, or tendon. And if we get into the back, sometimes we have more advanced procedures that maybe this minimally invasive lumbar decompression, in which we kind of remove some of the ligament to remove some of the stenosis of the back. This is another one called vertebrogenic back pain, in which is a nerve in the vertebral body that if you kind of ablate that nerve, it will take away some of that. We call it axial, which just means the isolated back pain. This does not shoot down your legs. That might be a great option. So there's a lot of great technologies coming up that we can help alleviate your pain and maybe not take any of those medications and still let you be active. And do you find that people get excited or interested when you introduce those options? I'm sure it depends on the patient. Yeah, it's definitely patient dependent. It's hard to change patients' mentalities. I just try to educate them is my thing. I think that's an important point. Yeah. Don't try to change, you try to educate. Yeah. I hope the information changes them. That's right. Yeah. And I give them this is the reason why I do things. And, the first thing I talk to my patients about honesty. I want to be completely honest with you. This is
what the visit is going to be like. I want to set expectations, because if you're thinking that I'm just going to come here and just give you what you want, that's not how things go.
Right.
So I want to be honest, and I want you to have trust in me that I'm here for you.
Yeah. That's so that trust, that honesty, that's such a, I know the cliched term is safe space, but you probably hear a lot because you create that kind of environment.
Yeah.
When a patient who has never had pain before comes in, I'm sure you get those, I know this would be me. I don't want to go on medication. How do you respond to that?
So I think the first thing is to find out the underlying cause of the pain. I think that's the important thing. Sometimes like we just have a reflex of just, pain. This is how you stop the pain. But I think in some sense that's appropriate, right? Because I don't want you to suffer. But I think at that point we have to like investigate your pain, do a deep dive. What caused it? How can we work it up? What imaging do we need? And then maybe I can not only stop your pain, but I can maybe cure your pain or help you with your pain. And I think that's an important factor.
So what are some of the effective ways of pain management?
Yeah, so the number one thing I think is education, educating the patient. So one of the things is try conservative management with like a physical therapy, acupuncture, massage therapy to kind of help the pain pathway.
Sure.
Because that decreases the pain pathway. And then when you get into the aspect, sometimes there's a psychological component. Like you're just kind of like, you think you're somaticizing, you're just saying like, I'm never going to get better. Sometimes you need to kind of change your thinking that I am going to have pain, but I need to be able to cope with my pain appropriately. Right. Because if I basically beat myself down and say like, my pain's taking over my pain, then I'm not going to work. I'm not doing what I need to do. Right. So that's not good for anybody. Right. So my job is to kind of help you change your thinking, provide any resources that I can, and then talk about like oral medication options. There are different oral medications, it's just not opioid. I explain this to my patient. There's a pathway from point A to point B. So you have pain, it goes to your brain sends a signal back. There's different pathways and highways that block that. Obviously, the pathway that we know is opioids. Right. But there's NSAIDs, there's Tylenol, there's muscle relaxant, there's neuropathic kind of medication. So I have different options to help you. And I think sometimes, you just want the opiate, but that's not the right. Right.
That's so fascinating because I think, and I'm just going off broad knowledge here.
Sure.
I think it used to be that opioids were the first resort.
That's right. Yeah.
I want to flag a few things you said. Acupuncture, massage therapy. I don't remember the medical profession always being on board with all of those.
Yeah, I think education. I think education is important. Like you have to let them know these are good treatment modalities. But the bad part about it is that it might not even be available in that area. Right. And it's also not covered by insurance. Right. And then if you don't have the financial means to pay for it, and it's not an option for you. But what I do in my clinic, I do this thing called trigger point injection, which is kind of like a fancy acupuncture that is covered by insurance that I can help treat you some of that myofascial kind of pain that you have.
Sure. Yeah.
And after that, sometimes I do a little massage into that area there to kind of alleviate the pain. So if it's not provided for you by insurance or you can't afford it, sometimes I try to do my best to try to give you that option.
I think, and your colleague, Dr. Srinivasan, he has the same message that he is trying to communicate to patients. It's not just opioids. There are more options. There are more ways. The technology is better. It's so good to hear that reinforced. It's so good to hear that you're working with that. Injury prevention and rehabilitation. That is about as broad a topic as you can get.
Yeah.
But the thing is, a lot of us don't do the common sense thing. Like write down, I can't tell you how many times I've started working out and I don't stretch starting out. I mean, that's...
Yeah, I'm guilty of that too. I actually, unfortunately, last year, I suffered a back injury and now I do a little bit more stretching. I do a little bit more warm up. And actually, I do more a little bit at-home therapy now.
Okay.
And I think that's the important part. I think sometimes people just want the shortcut. It's like, hey, just take my pain away. But you have to find out the under cause of your pain. If you're having back pain, you have to strengthen up your core, your glute muscles to kind of keep your body erect. And that's an important factor of that. Yeah. So you have to do the injury prevention thing, go to physical therapy, try to make sure you stay strong, eat healthy. The more pound and weight you have, the more strain you have on your back. Your body is not designed to hold extra weight, right? So you're putting extra stress on your joints.
Right.
So education, again, like I had a patient yesterday, it's like, look, dog, like I can't lose weight because my pain's hurting, I can't be mobile. So how do you I get that. You can, I understand it completely, but you're still not decreasing the caloric intake you're taking, right?
Right.
You're still taking those excess calories. Now you're not burning them because you're not working out, and now because you're not burning them, you're gaining weight.
Right.
So how do we counterbalance that? You have to decrease the caloric intake. So it's not appropriate for you to keep eating the same thing when you are not being active.
I think what I'm really enjoying in what you're saying is, yes, things happen to us that we can't prevent, but there are things that happen to us that we can prevent. But behind every injury, behind every instance of chronic pain is a story that is multifaceted, that often connects with diet, exercise, common sense measures. How important is it to learn the story behind their pain?
Oh yeah, that's the first thing. My first question when I come in is just an open-ended question. How can I help you?
Yeah.
And that gives them the room to just let me know what's going on.
Yeah.
Right. I read the story and I read everywhere, but I want to hear from you.
Right.
Right. So I want to hear, sometimes, information can be presented a different way. So I want to hear from them, and I give them the opportunity to let me know what's going on. And then I make my own kind of determination based on that. So I try not to get blindsided by different specialists.
It probably gives you a clue, various clues as to what led to the pain, what they may not have done to prevent it on their part.
That's right.
Yeah, that's fascinating. Are there any other treatment options we didn't cover?
I think number one thing is just find the underlying cause and treat that. I think just stopping the pain is not the best treatment option right now. So when you come see me in my clinic, I make sure that I listen to your whole story. I find the underlying cause, and then sometimes if there's a fix, I try to fix that for you. In addition to that, I have additional experience in like regenerative medicine as well. So I do a little bit of that when appropriate.
What's regenerative medicine?
Regenerative medicine is you apply a solution to a specific area and it hopes that it will heal itself.
Right.
Yeah, so you provide healing factors to that area.
So you're stimulating what the body can already do.
That's right. Yeah, and then sometimes that's very inappropriate, especially when you have chronic tendon pain, ligament pain, sometimes osteoarthritis. The only downside of that is it's generally not covered by insurance, so it's out-of-pocket cost.
Sure.
But I tend to give the patients the options. I educate you on these are the options, right? And then I do my best on what is covered and what financial means you have to provide you the best pain relief to get you back into the community to go back to work and stuff like that.
You're really addressing the whole person.
That's right.
Because you're not just handing them, here, do this, get this prescription. Oh, you're insured, sorry, but that's what you need.
Yeah.
You really work with them, and that goes right back to what we just talked about, the story.
Yeah.
You have to understand not only what led to the pain, but who they are as people.
That's right, yeah.
What are some messages that you would like, or a message that you would like to convey to those watching this today or listening to it?
So I would like to convey that if you have pain, it's not the end all be all. I think there's ways that we can help you. There's definitely a lot of ways. You just got to be open to it. There's definitely a lot of ways. It's not only medications, other sources that we can provide and help you to get you. You just got to have the right mind, positive attitude to make sure that we work together as a team to get you where you need to go. So you have to have a goal. I can help to that goal.
How often do you have to address the psychological factors that are?
Pretty often.
Yeah.
Pretty often. The good thing is that some medications actually not only help with pain, but also help with that depression, anxiety symptom that you're having.
Yeah.
So I give them the option. Look, I understand you're going through this tough time, but I have stuff that could potentially help you in both aspects. It may be long-term, maybe short-term, but I think finding something that could help you will be beneficial, because if you come into the mindset that this is not going to work and nothing like that, then you already failed.
Right. So attitude, as they always say, and this is becoming more prominent in medicine, attitude is, you need your patients to have a positive attitude, to have a positive outlook. It sounds like you also do a lot of work. It's a cliched word now, everyone uses it, but empowerment. Empowering the patient. I love what you said about pain isn't the be all and end all.
Yeah.
I think sometimes it's easy to fall into that trap where you think, well, this is who I am.
Yeah.
No, you're independent of the pain. You still have your whole being apart from it. So
That's right.
Yeah. Any final thoughts? Anything that I didn't give you a chance to convey that you would like to talk to our audience about?
I don't think I have any final thoughts. I just think that this is a great organization, and that if given the opportunity, I think we could potentially help you a lot and get you back into the community, help you achieve your goal. And yeah, I think that this is a great organization that patients are lucky to have.
Well, we're a great organization because we have folks like you working for us with an incredible background. And you strike me as a pretty young guy.
I'm not as young as you think, but I really appreciate it.
But you've done a lot with your life, and you've done a lot. I mean, I didn't even realize that you were into regenerative medicine. That's
Yes, I'm also in the military as well.
Yeah, that's right. I forgot to address your military service. How long were you in the military?
I'm still in the military. I have 14 years in service so far.
Well, thank you for your service as well. Well, you're a very impressive individual, and your knowledge base is enlightening. So thank you for being so current with it.
Yeah.
Thank you for staying abreast of that, and thank you for working in this area with a very troubled socioeconomic class of patients. So
Of course.
we are fortunate and blessed to have you.
Of course. I'm happy to be here. Happy to help.
Absolutely. And thank you for being on the show today.
Thank you.
And we will see you next time. Thank you so much for listening and watching. I hope you'll check out our YouTube channel, Trinity Health System, for an archive of past Trinity Talk episodes. We'll see you again next time.